All you want to do is sleep, or you can't sleep. Your body hurts. You're irritable. Your concentration has gone missing. It's as if all the light has gone out, even though all the lamps are turned on. These are all signs of depression, a mental health condition related to the abnormal balance of brain chemicals that regulate mood and cognition. Left untreated, it can have a significant impact on your life, including job loss and relationship problems. It is also a leading cause of suicide. So just as you wouldn't try to heal a broken ankle or a serious infection on your own, depression isn't a condition to try to heal by yourself. Research shows that most people with depression will require medication, often together with psychotherapy to recover. The two together, medication and therapy, work better than either alone. But taking medications can cause side effects that may interfere with other aspects of your life. Today, we have more than 20 medications approved for the treatment of depression. All work to regulate levels or the function of certain brain chemicals called neurotransmitters, which send signals between different parts of the brain, influencing how you feel and think. Serotonin, for instance, helps control mood, emotions, and happiness. Norepinephrine plays a role in the fight or flight response, as well as anxiety, attention, endurance, and concentration. Dopamine is known as the feel-good chemical, involved in feelings of pleasure. The most commonly used medications are selective serotonin reuptake inhibitors, or SSRIs, which work on the serotonin pathway, and serotonin and norepinephrine reuptake inhibitors, or SNRIs, which work on the serotonin and norepinephrine pathways. Older drugs such as tricyclic antidepressants and monoamine oxidase inhibitors, or MAOIs, are not used very often these days for major depression, given their side effects. Finally, there's a catch-all category of atypical antidepressants that have unique ways of affecting neurotransmitters. These include trazodone, or Eleptro, mirtazapine, or Remeron, Simbax, a combination of the antipsychotic olanzapine and the antidepressant fluoxetine, bupropion, or Wellbutrin, vortioxetine, or Trintellix, and vilazodone, or Vibrid. Each drug acts on different neurotransmitter pathways, primarily serotonin, norepinephrine, and dopamine. Any discussion about medication and other treatments, however, must be personalized to focus on what's important to you and will be of benefit to you, not just how the drug works in large populations. After all, while your doctor may be the expert on your disease, you are the expert on yourself. The best way to describe this is that your doctor should talk with you, not at you. For instance, your doctor may recommend a very effective medication that may lead to weight gain. If gaining weight is absolutely off the table for you, let them know. Or a medication may be ineffective for you because of your genetics. Key to this discussion is trust. Trust in your doctor, but also your doctor's trust in you. Depression is a challenging problem. The only way to diagnose it is by letting your provider know how you're feeling and what's going on in your daily life, either by filling out a questionnaire or describing your problem. That calls for honesty. Your doctor should never judge you. If they do, you need to find another doctor. Your provider also trusts you to take your medication as directed, even after you feel better. It may take a couple of weeks for the medication to begin working, and a few months before your doctor talks to you about stopping. Give it time and trust in the process. Eventually, that light will burn bright again. Throughout the process, ask questions. How well does this drug work? How does it work? What are the side effects? How do I take it? How soon will it start working? Will I know if it's working? How much does it cost? What if I miss a dose? How will it make me feel? What are the short and long-term benefits? The question is whether the risks of side effects outweigh the benefits of the drug for you. Common side effects with antidepressants include weight gain, loss of sexual desire or excitement, nausea, dizziness, and dry mouth. One side effect that isn't talked about much, but that is extremely common, is emotional blunting. Many patients have never heard of emotional blunting. It's when you've started to feel better from the depression, but you still just feel blah. You don't feel sad, but you also don't feel happy. You just feel like you're walking around wrapped in cotton with everything muffled. Think of it as a 40-watt light bulb versus a 75-watt bulb. This could be residual depression, but it may also be a side effect of the antidepressant you're taking. Up to 7 out of 10 people taking an SNRI, SSRI, or tricyclic antidepressant experience these feelings. People describe it as an emotional numbness, feeling distant and detached, not being able to cry or laugh when appropriate, or simply not feeling like themselves. The more severe your depression is prior to treatment, the greater your risk. Men tend to be affected by emotional blunting more than women. This is when many people give up and just stop taking their medication. That's a bad idea. Not only could you experience withdrawal symptoms, such as digestive or sleep problems if you abruptly quit, but you may find the depression comes roaring back, often accompanied by anxiety, agitation, and insomnia. In fact, stopping your medication for any reason can be dangerous. Even when you're feeling better, you still need to take it for several months or until you and your doctor decide to taper it off. If you're experiencing emotional blunting or just haven't noticed any improvement in your symptoms within 2 to 3 weeks of starting on the medication, talk to your doctor. They can determine if the numbness is due to the medication you're taking or the depression itself. Either way, they can change your dose, switch your medication, or add another drug. Not all antidepressants have the same risk of emotional blunting. Research shows that bupropion, or Wellbutrin, and vortioxetine, Trintellix, are less likely to cause emotional blunting, while duloxetine, Cymbalta, seems to be more likely. Depression is not just about feeling down. It's a life-threatening condition. The good news is that it's very treatable, with new therapies emerging all the time. The key is identifying the right doctor and medication to help you find the light again.